RCP and other things. But they were not recognized. So how this will work over here? Then actually they took a decision that whatever degree will keep aims away from the mandate of MCI, and what are the degrees they will establish, and what are the doctors who come from abroad to work with us, that actually need not to be actually recognized by the Medical Council of India. But of course, as on today, there are some doctors abroad, whether they are foreign doctors or Indian doctors who are working on the, they are very keen to come over here and they keep on coming to AIMS Delhi. But for that, they are involved in teaching, research, and skill development. And if they have to be involved in the patient care, like surgery and other things, then yes, we always take a permission from Medical Council of India to allow them to operate in our actually healthcare settings. Now, our Trinity of mission. On the top is education, then followed by research, then the patient care actually. So whenever any faculty joins in All India Institute of Medical Sciences, first we ask them that your first priority is education, and you have to spend 30% of your time in the education, in teaching, and 30% of the time you have to spend on the research. 30% of time they have to spend on the patient care, and most importantly is that 10% of their time they must spend for community work. So that community work is also very important actually. Like our doctors, they go to community and work over there, and that is an important component. Whether it's a doctor, whether it's a nurse, whether it's students, they are posted in the for the community work actually. No, this is the vision of Honorable Prime Minister of India, Shri Narendra Modi ji. You know that actually this aims like concept was started in 2004 when Honorable Shri Atal Bihari Vajpayee was the Prime Minister, and Srimati Sushma Swaraj was the Health Minister. So they actually thought actually that why so many people come to AIMS Delhi, and I was part of that actually study. We found that the patient is coming from different states like Bihar, West Bengal, Odisha, UP, Rajasthan, and Adjani areas. And at that time, the number of patients, which is as on today also, there are about 14,000 to 16,000 patients a day. Then people, they have to come from far off areas actually. They have to spend a lot of money. Then actually sometimes they have to sell their assets, some cattle, to generate, mobilize resources to come over there. Treatment expenditure on treatment was very negligible, but the more expenditure was on staying outside the institute, maybe for 1 week, 2 weeks, for cancer patients, 6 weeks actually. So they thought why not to actually provide similar type of facilities near to the doorsteps, right? So that was the whole idea. To begin, 6 aims were established. So as on today, I said that there are 22 already working, and 2 more has been announced. Actually. Then keeping that legacy forward, so this was our vision of Honorable Prime Minister. He said that aims like institutions, they aim to address regional healthcare imbalances, encourage evidence-based research, and elevate medical education standards in our country. They said that putting 6 only aims in few states is not justifiable. Actually. Why not to establish more aims like institutions so that every state should have one, and luckily our state has got 2. So that was the idea actually of the Prime Minister, that we must give at least minimum 1 aims to each state. Actually. Now, what is our vision in AIMS Jammu? We are developing AIMS Jammu as a global village of healthcare. What I mean to say about the global village is that AIMS Jammu envisions a global village of patient-centric care, blending technology, skilled manpower, affordability, and Indian values to deliver world-class, accessible healthcare for every citizen. In addition to that, what a decision we have, policy decision we have taken by the governing body, that we can invite the doctors of Indian origin who are working across the globe, Why not to invite them? They can start working with us, right? And they will be involved in teaching, in research, and skill development. So that decision is already been taken. And now the doctors have started. I'm happy to share that our Indian doctors, they have started coming to AIMS Delhi, and as on today, so there are 74 doctors who are waiting to visit AIMS Jammu, because we have given a appeal to all the doctors who are working abroad that AIMS Jammu is an opportunity. You come over here, work with us in the research, in teaching, in skill development. Actually. So they have started coming, and every month we have few faculty and experts, not from the country but across the globe. Actually, they are coming, started coming. Actually. Now we'll actually, if most of the Indian doctors who are coming, they are coming on their expenses. But we have kept a provision. If there is some faculty, we invite him in a particular subject, in a particular specialty, we can pay them air ticket. We'll give them a dignified stay in our guest house, and we'll pay them a token pocket money of 5,000 per day. So that will take care about the painting the key. And this scheme has already been approved, and it is also the government guidance has also come actually. I think this is a big step for AIM Jammu and for other institutions also actually. So that actually we want, that our faculty is quite young actually. So then actually we want senior people not from countries, from other countries also. We should come and guide them actually, and have a mentorship program with us actually. Sorry. So then another important, there are certain unique initiatives of AIMS Jammu. Our focus is patient first. If this building is there, we have created a beautiful infrastructure, our architecture, our technology, our equipment which we have brought, keeping patient in mind. See, what are the requirements for the patient? If these buildings are there, I am there, my doctors are there, they are for the patient. So whatever activities we are doing, doing keeping patient in our mind. Like patients, when patients come, their attendants where to stay. We have a very good and beautiful night shelter for them actually, so that they can have a dignified actually stay over here. Actually. They can accommodate to 16 patient attendant, but we are working on another also. Then another is that we have made AIM Jammu as a pain-free AIMS, and our Lieutenant Governor, Honorable Lieutenant Governor, when he visited on 31st of January, he has declared AIMS Jammu as a pain-free AIMS. What our idea is about pain-free AIMS is that whenever a patient comes, the pain should be outside the hospital. When they come to the emergency, to the ward, or after operation, they should not feel pain. So our doctors, department of anesthesia, they take care, extra care that they should not feel pain. They should be comfortable actually. So that is the idea of free pain. AIM Jammu leads the way as the region's first pain-free hospital, ensuring healing without suffering. So these are the different milestone activities were there actually. We started actually, this cabinet approval was in 2019, then foundation stone by Honorable Prime Minister in 2019, Gazette notice in December 2019, then Bhumi Pujan by Honorable Dr. Jitendra Singh, then inauguration by Honorable Prime Minister on 20th February. Uh, Inauguration was at that of infrastructure. At that time, this hospital was not functioning actually. And then commencement of hospital services were on 1st of August 2024 actually. Because when you want to start a hospital, you need that access should be there, CT should be there, MRI should the diagnostic services like lab services should be there, OT should be ready. If suppose some patient comes with a roadside accident, what I will say that I don't have OT, I don't have a CT or MRI. That's why we have taken about 5 to 6 months after inauguration, so that everything should be there before we open our hospital to the public. So that's why we are started on 1st of August 2024. Now, this is the inauguration by Honorable Prime Minister. Actually, they were very keen to inaugurate AIMS Jammu along with the other 18-19 projects from AIMS Jammu only. So, two times the SPG team, they came over here, actually, they did the survey. They asked us to make the arrangement for about 25,000 people. We informed that actually we can accommodate 1,000 in auditorium. Okay, we can arrange outside actually 5,000, not more than that, because road was already ready actually. So twice they came actually. Then ultimately they decided to inaugurate this and other IIT and IM and other 18 projects from the Maulana Azad Stadium. So this was inaugurated from there actually. So this is, you can see that when they inaugurated. देश का ऐसा राज्य है जहाँ दो एम्स बन रहे हैं, इनमें से एक का उद्घाटन आज करने का मुझे सौभाग्य मिला है। आजादी के बाद के अनेक दशकों तक दिल्ली में ही एक एम्स हुआ करता था। गंभीर बीमारी के इलाज के लिए आपको दिल्ली जाना पड़ता, लेकिन मैंने आपको यहाँ जम्मू में ही एम्स की गारंटी दी थी और ये गारंटी मैंने पूरी करके दिखाई है।